first is going to be the review of the top 10 violations for licensed home health agencies and personal assistance services agencies under those two categories, and then also preparing for the survey. And then the second topic that I'm going to cover is regulations for supportive palliative care in the home care setting. Oh, these topics are absolutely timely. As always, agencies have questions about and need guidance on the licensing topics and licensing violations. The top violations discussion will tell you what are the top violations that we see when we come out and do investigations and surveys of agencies. That's from our annual report. And those are really connected to an agency determining whether or not they are in compliance and know what documentation a surveyor is going to ask for and what they'll review and what they'll look at when they're in your agency. So it helps an agency to be prepared for a survey. One of the reasons why this is really a timely topic as the pandemic or public health emergency is starting to reach more endemic levels, the agency is conducting surveys that are more broad than they have been in recent years. So we're no longer focusing just on infection control. We're looking at the totality of the regulations. And so plans of care, care plans, interdisciplinary plans of care are going to be things that we're looking at specifically on a more broad basis. And this will help agencies to be prepared for what the agency is going to be asked to provide. And then definitely for supportive palliative care, we've seen over recent years there are a number of agencies who are interested in providing supportive palliative care. So we're talking about home health agencies primarily when an individual has not elected hospice. And the questions that people have asked is, how do you do that under the home health setting, especially as the larger healthcare industry is looking to home health providers to relieve hospital-based models of care so that individuals are getting that supportive palliative care in their home or home-like setting versus being in a clinic or clinical setting in a hospital. So definitely both very timely topics, I believe. What I'm hoping that you walk away with, especially in the first session for the top 10s, is knowing how to prepare your agency for answering the questions when a surveyor is at your door, knowing what documentation is necessary on an ongoing basis to prove that you've provided care in accordance with a care plan, plan of care, or individualized service plan, and to review that in your own QAPI. So looking at those top violations and maybe focusing on those specifically in your QAPI program. And then I think that what I'm hoping that you come away with from the supportive palliative care discussion would be looking at how to use case conferences and how those are a tool that is provided in the existing licensing standards, what we would expect from agencies who are providing supportive palliative care to have coordination of care, and how to define supportive palliative care under the home health setting.